Hello, everybody. I am Deena Kishawi. I am Chief Resident in OBGYN at Ascension St. Joseph Hospital located in Chicago, Illinois. It's a pretty small community hospital, but I am here to talk to you about being Muslim in the hospital. This is going to be a two-part lecture. The first half of it is about how to take care of Muslim patients, specifically in surgical specialties, but a lot of the stuff is applicable throughout any part of the hospital care. And then the second half is about how to better support Muslim trainees throughout residency. I will say a lot of this stuff can be transferable skills about how to support Muslim um, people in the job field. So this stuff could definitely be things that you could learn from both from the clinical aspect and the non-clinical aspect. So starting off with Muslim patients, just a little brief introduction on Islam 101. I want to talk extensively on the health disparities of Muslim patients. So lots of research has shown us that minority patients have a substantial healthcare inequity and inequality when compared to their non-minority counterparts. So when we're looking at Muslim patients, they are actually a conglomerate of a lot of different race and ethnicities. When you look at America's Muslim population, you have about 30% who are Black Muslim, about 30% who are Southeast Asian Muslim, about 20% who are Arab, and the rest who are a pretty diverse spread from Eastern European Muslim, Central Asian Muslim, Hispanic Muslim, and then really just a small percentages from many different backgrounds. So because it's such a huge and diverse background, it's very difficult to group them all into one category or to say that they all come from a very similar culture or background. Really, the only thing that Muslim patients have in common is their religion. But because of that, unfortunately, there is a lot of inequality with how Muslim patients are treated. There has been multiple studies showing that Muslim women have received greater rates of lesser care in the fact that Muslim women felt that they were ignored, discriminated against, or they felt that they weren't feeling heard when it comes to gynecological care, obstetrical care, or even just primary care. And this hasn't been a relatively new occurrence. We see this across the spectrum with a lot of our minority patients. So that is one thing that is really particularly important when we're looking at our Muslim patients, especially over the last couple of years, as we've had a huge influx of refugee and immigrants. Now, over the last 10 years, the large majority of refugees into the United States has actually been Muslims. So the Syrian refugee crisis and the Afghani refugee crisis has actually been the result, obviously, of political turmoil in the Middle East and in Afghanistan, but that has resulted in millions of Muslim refugees coming into the United States. And then ever since the early 1900s, you have a huge group of Muslim immigrants that have come into the United States. And so a lot of our Muslim patients are first or second generation immigrants. And that comes with its own specific ways to handle healthcare. One, because it does have its own psychological way to handle how you talk about current culture crisis, the psychological aspect regarding why people fled their country if they're there for political asylum. But there are some cultural nuances to patients who are coming as refugees and as immigrants. One of the biggest issues that we see with our Muslim patients is a post 9/11 psyche. After 9/11, a lot of our Muslim patients developed a huge mistrust in the government and an even larger mistrust in public health care. I'm talking specifically like public health systems, public university, hospitals, federally qualified health centers. And the reason is because after 9/11, there was a very large program where mosques and Muslim community centers were under surveillance by FBI, and they sort of implanted themselves in inconspicuously. It made Muslims feel very uncomfortable knowing that they could always be sort of under surveillance, or they could always be watched. And because of that, it created a huge sense of animosity between Muslims and the federal government and anything related to that. Now, from that, Muslim patients might not always be very forthcoming when it comes to demographic surveys. So talking about how much they make when it comes time to fill out any of the intake forms in the hospitals, what their level of education is, how long they've been in the US, if they are refugees or immigrants, how many people there are in their family. So our numbers and our statistics for how many Muslims actually live in the United States is substantially underrepresented because of this. The other thing is there has been a substantial uptick in Islamophobia directly after 9/11, and unfortunately in today's current political climate. So Muslim patients do report substantially elevated rates of PTSD compared to their non-Muslim patients. And we see this in people who look very visibly Muslim. So Muslim men who wear traditional Islamic clothing or who grow their beard or who wear the kufi, and Muslim women who wear the abaya or who wear the hijab. So anything that makes them look outwardly Muslim. One of the other things that is prevalent amongst any minority community is there's always provider bias, which we inherently bring to the table, whether or not we know it. But we come in with our own preconceived notions about all faiths and all different cultures. And we sometimes will put these onto the patient in a sort of patriarchal sense, where what we know of the culture or we know of the religion, we then force without thinking, and we do this subconsciously, onto the patient. Sometimes we take the incorrect stereotypes that we've learned from the media or from the pop culture, and we pretend or we think that all of our patients are going to fit that sort of spectrum that we've seen and that we're used to. And because we don't often see, I don't anticipate that there's that large of a Muslim population here, we don't often see Muslim patients. Providers are uncomfortable because they're not that familiar with how to deal with Muslim patients. And oftentimes they don't actively go out to seek the information on how to deal with and how to provide culturally competent care. And it becomes this vicious, self-perpetuating cycle of providing care that does not have adequate familiarity with the patient's background. And it does create a sense of mistrust further in the healthcare system. A little very brief 101 on the religion itself. We are one of the 3 monotheistic religions alongside Judaism and Christianity. Worldwide, we are the 2nd largest religion. There's about 2.5 billion Muslims across the world, and we are the fastest growing religion in the world. In the US, we are the 3rd largest religion. The number, the 3.35 million Muslims, as mentioned, is substantially underreported, and this number was from 2017. They suspect it's probably closer to 5 million in 2023, give or take, just because people are not always forthcoming and with the growth of Islam worldwide. But the 5 largest hubs of Muslims nationwide are in Detroit, Chicago, the Bay Area, Houston, and then New Jersey, New York City, specifically in Brooklyn, and then Patterson. But Chicago is actually now the largest Muslim population in the United States. One thing that I really want to emphasize, especially because there's a lot of misconceptions about women in Islam, is the difference between culture versus religion. We as a religion have a very diverse background, and because of that, oftentimes people's culture blends a lot with their religion. And the religion itself does have some overlap with people's culture, especially because of how deeply embedded the religion becomes in our way of life. Some of the cultural nuances, especially in the Middle East and Southeast Asia and Africa, sometimes become a little overbearing and do take over parts of the religion. And for some people who are unfamiliar with culture or who are unfamiliar with Islam might actually accidentally mistake the two and think that how somebody is behaving is a way of the culture as opposed to the way of the religion. And I want to emphasize that the religion of Islam itself puts women in a very high position and actually gives them a lot of rights to make decisions on their own. So women have full autonomy to make decisions of healthcare for themselves. They have full autonomy to make financial decisions on their own, decisions about birth control on their own, in conversation with their spouse, decisions about their education and further. So they have a lot of independence and a lot of rights based on their religion. Now, sometimes people's culture might be clashing with the religiosity aspect of that. And sometimes people are willing to go more towards the culture. And that's where you get this misconception that women are a little bit more conservative or more oppressed. And that's unfortunately a more Western concept. But I do want to strongly emphasize that women are incredibly independent and very much exalted in the religion, and are brought on a very high standard in Islam. The other thing that you are going to very much be familiar with if you deal with or work with Muslim women is the hijab. So it is overarchingly a concept of modesty that is intended to help the Muslim woman with her religious obligation. And it's one way that we can practice that modesty. Men have their own way of practicing that religious obligation of modesty, but hijab is for a woman to cover everything but her hands and face in front of anybody who is not her, in front of any male who is not her direct family member. And the actual garment of the hijab itself can be worn in different styles. A lot of it is more of a cultural phenomena. So the way I'm wearing it right now, for example, is a traditionally Arab style. Sometimes people will wear it as a turban. That's more of an African style. Sometimes people will wear it loosely draped, and that's more of a Southeast Asian style. So there's different ways that people will wear the hijab. The garbs that you'll see, like the dresses, the long black dress that people refer to as the abaya or the burqa, all of those are different cultural aspects of the hijab. And so those are just some of the more nuanced things, but the purpose of the hijab is to help maintain modesty for the woman. And then in the broader scheme of things, it's to prevent the sexual objectification of women across society. Some other special considerations is we have a pretty, relatively speaking, normal diet, with the exception of two things. Overwhelmingly, majority of Muslims will follow that they don't eat pork and they don't consume alcohol. There are some Muslims who eat something called sabiha halal, and this is a way that the meat is prepared and slaughtered. So the meat has to be ethically sourced and ethically raised. So for example, they can't be like machine slaughtered. And when it is time to be slaughtered, it has to be done on a one-by-one basis. And right beforehand, whomever is slaughtering will pray and recite something. That meat that then gets split evenly and cooked and prepared in a specific way. But this is something that you will oftentimes refer to as halal, or sometimes people will say, oh, I practice or I eat sabiha. Some people don't follow that because they might not be as observant or as religious when it comes to that part of the diet. But overwhelmingly, the majority of Muslims will follow at least the part of not eating any pork or pork-based products. That does include things like gelatin, and then not consuming alcohol. Another special consideration is gender interactions. So again, on the more conservative spectrum, opposite gender interactions in terms of physical touch is prohibited. So some people who are on the more observant side won't shake hands with people of the opposite gender. They won't hug with people. They won't hug people of the opposite gender. And if they are in a situation where they have to be with somebody of the opposite gender in a private setting, sometimes they'll leave the door open, or they won't, in a patient setting, they won't close the curtain, just to make sure that there is no room for any sort of temptation, for lack of a better phrase. So, for example, if you have a patient or a coworker, somebody who is Muslim, don't be offended if they don't shake your hand when you go to extend your hand. I know one thing that some people do is they'll try and gauge what the situation is like first. And if the patient or if the coworker puts their hand out first, then they know that that's a welcoming sign. If not, some Muslims will then put their hand on their heart as a way to sort of broach the subject of, I'm greeting you, but I'm not willing to shake your hand because I don't shake hands with people of the opposite gender. One of the biggest issues we have here in the US is that heparin is porcine based or pig and gelatin based. In other parts of the world, it is readily accessible to get bovine or beef based heparin because they do use the gelatin from the beef. But in places like Detroit and Chicago, where they have such heavy Muslim populations, there is a huge push to get the beef based or the bovine based heparin on formulary. And then other things like these very, very common vaccines are all containing gelatin or alcohol. And there are some alternatives for this, but this is always a conversation that you can bring up with your patients to see how many of them, sometimes some are like, it's okay, I'm willing to take it. Some of them are like, well, if there's an alternative, please give me the alternative. And then some people are like, I will only take the alternative, or I just won't take any of the vaccines at all. So if you know that you're going to have a Muslim patient come in, make sure that you have the alternative or something readily available for them. And then one final note on this aspect is the death and dying or the palliative care of Muslim patients. We face Mecca when we pray. So I should have mentioned this earlier, but Muslims will pray 5 times a day. The first one is at dawn. The second one is as the sun is rising, but before it hits its peak. The third one is when the sun hits its peak. The fourth one is as the sun is setting, and the fifth one is at night. And we face Mecca, which some of you might know as like that little black cube that everybody is walking around in Saudi Arabia. But that for us is our holy site, and it's a very religious place for us. So people would prefer to be facing in that direction as they're taking their last breath or when they're dying, just because in that moment they can be making their last prayers and their last wishes if they have to be at the hospital during this time. If not, people would like to, at the very minimum, be at home to be with their family or surrounded by their family. Some people will have the Quran, which is our holy book, in the background playing. So if you have ever been in a Muslim patient room, or maybe you've had coworkers who'll do this, but they'll recite or they'll have the recitation of the Quran in the background. We have Muslim scholars or imams who will recite the Quran in a very melodious tone. It almost sounds like a song if you pay attention, but it's just the way that the Quran is read. And people will have that in the background as a way to keep in remembrance of the religion. But sometimes, people will have that playing in the background as somebody's taking their final breath. And then lastly, we, before every single prayer, are always in a state of cleanliness. We do something called wudu, which is a way to wash up before prayer. Before people, especially if they know, for example, that they are going to die or they're taking their final breath, would hope to be in a state of cleanliness as well. So a prime example of this is, if you're in palliative care, or you're going to, for lack of a better phrase, be pulling the plug, families will ask that they are able to perform wudu for their family member by, helping them wash up so that they're in a state of cleanliness and purity as they're dying and before they go into the afterlife. So switching gears, we're going to talk about Muslim trainees, and we're going to talk in two parts. One is the challenges that they face during their training, both in medical school and residency. And then the second part is about opportunities for improvement and ways that we can help them for success. So firstly, hijab is a very big issue that we see in medical school and in surgical residencies. And it's a problem mostly because people are unfamiliar with how to deal with hijab when it comes time to scrub into the operating room. This website is a national initiative that I've been working on since I was in medical school, so it's been some time, but we were able to get policy pushed through different smaller organizations in the hospital and currently through the American Medical Association to ensure that all medical schools and all places where there are surgical residents have accommodations in place for trainees. So the biggest issue that's always come into place is majority of hospitals let people wear scrub caps. Like they let male surgeons wear scrub, male or female surgeons actually wear scrub caps, like ones that have football teams or cartoons on them, but they're pretty strict about not letting women who wear hijab in. And this created a huge point of contention because for the most part, if you're letting people come in with scrub caps, there shouldn't be an issue with people coming in with hijab, especially if they follow the same compliance. So when we were first looking into what are the reasons, one of the biggest issues of concern were people were worried about the sterility of the hijab and how it would affect patient care. There was a lot of studies that show that wearing a scrub cap or wearing the hijab would not actually change rates of infection for surgery. So under that guise, we pushed really hard for allowing hijab to be worn in the operating room without needing anything on top of it. The Association for Perioperative Nursing helped push their own policy along as well, so much so that they've even changed the guidelines to make it allowable to wear hijab in the operating room without putting anything on top of it. But it has to fit certain specifications. So now a resident or a medical student, or actually anybody who's in healthcare, can wear a hijab in the operating room, even a patient themselves, so long that it fits certain criteria. The first one is it has to be light colored. So anything where if blood were to splatter, they would be able to see the differentiation in color. So white, beige, like light tan, things of that color. It has to be tightly woven. So think of like the scrub fabric or like t-shirt fabric. It has to be plain and without adornments. So it can't have any sparkles or glitter or anything that's sticking out of it, like any embroidery or anything of that sort. It can't be held in place or secured with anything like pins, just because they fear that if something were to fall off the hijab and into the sterile field, and it has to be low lint material. So it can't, if it's washed multiple times, it can't become linty from that. And now they allow people to wear the hijab, and then so long that it's laundered and properly taken care of, they can keep it in the operating room, or they can keep it in the hospital so that they can wear it in the operating room. The other thing is, because scrubs are short sleeve, the issue that a lot of our Muslim women face is they need long sleeve scrub jackets. Not every hospital has them readily available, and not every hospital has them readily available in the right place. So once people get dressed and they're in their scrubs, they should have these readily accessible to them in the locker room so that before they leave, they have a scrub jacket on. It's probably most useful to have one that's like the laundered one as opposed to the disposable one, so they're not going through these regularly, and you just have one sort of assigned to each trainee or each resident. And then when we were looking at this, we looked at how they do this in hospitals in the UK, where there's a huge Muslim population in the healthcare field, and then surgeons in the Middle East, how they do this. A lot of them will actually scrub first. So the Muslim women will have separate scrub sinks where they'll scrub just because, you know, they're exposed and they feel uncomfortable that they're so exposed, and they'll go and they'll put on their surgical gowns first. Some people, especially those who might feel a little bit more observant, will scrub and then will put on sterile sleeves, and then they'll put on their surgical gowns. And that way, when they break their scrub and they take off their surgical gowns, they have that extra layer of protection so they're not fully exposed in the operating room. I mentioned before that men have their sort of version of the hijab, or their version of modesty. For them, that's keeping their beard and keeping it long. There are beard covers for men for the operating room, and that for those who have never seen them, they're like little ear loops that look like a little shower cap on with ear loops that go over their beard, that allow them to cover their beards while in the OR while maintaining sterility. The one issue that we never anticipated and probably didn't think was going to be that big of an issue until COVID hit was that the N95 masks and a lot of our PPE does not fully take into account a fully grown beard for a male, partially because it doesn't have a great seal on the bottom aspect of things if they have a fully grown beard. And so the N95 actually doesn't give a good seal on the bottom half. There are other different masks that do, but making sure that your trainees have the proper protective equipment for that. I think the N99 does provide a good section for that, but make sure that they get fitted for that in advance. Like I mentioned, Muslims have an obligation to pray 5 times a day, and you should be able to offer a safe space for your trainees or your coworkers to pray that's easily accessible. One thing that people might not know is during these prayers, we don't, we're praying, it's actually a very physical prayer. We bow down into prostration, we're getting on the floor. If you've never seen a Muslim pray before, I encourage you to just look up like Muslim prayer on YouTube or on Google Images, just so you know what it looks like. But during those times, we don't talk to anybody. So if you, like tap us on the shoulder, or if you're trying to ask us a question, we're not going to answer you until we're done. But just making sure that they have a safe space to pray. I know when I was in medical school and undergrad, there wasn't a safe space at the, readily available, and we didn't have a chance to run to the prayer room. A lot of us would just pray in like a stairwell. So that's not really the most convenient place, but if you have somewhere for your coworkers or trainees to pray, allowing them to go somewhere that's safe. Another thing is allowing them to step away just for 5 to 10 minutes, either if they're in clinic or in lectures, just so that they don't miss the prayers, because they are on a time restriction. And then lastly, Muslim men are obligated to attend Friday prayers. It's not mandatory for Muslim women, but a lot of them would also still ask to do it. They're on Friday afternoons, usually around 12 or 1 p.m., depending on the daylight savings. But this is, I would give the best analogy to like our version of Sunday Mass. It usually starts off with a 20 to 30 minute lecture, and then it's followed by the prayer itself. And because it is a little bit more time consuming, some residents and med students will actually find a way to accommodate this in their day-to-day schedule, or in their weekly schedule with lectures and with clinic. So Ramadan is one of the other sort of big things with Muslims. It is our holiest month of the year. And for us Muslims, our year is based on a lunar calendar, so it changes from year to year, which is why Ramadan does not always happen at the same time every year. Every year it moves up about 10 days. But this year it's going to be around middle of May, or middle of March rather, to middle of April. And in Ramadan, we fast from dawn until sunset. And fasting means abstaining from all foods, all liquids, including water, coffee, everything of that sort. The people that don't have to fast are people who have any sort of chronic illness, women who are menstruating or who are pregnant or who are breastfeeding, and then the elderly, and then children. So people sort of who meet those qualifications or those exclusion criteria don't have to fast, but everybody else who's fasting doesn't eat or drink from those restricted hours. So one thing that we can do to accommodate is trying not to schedule really difficult things for our trainees during that time, either not having them on really difficult rotations or allowing them to sort of start the day later if they're on lighter rotations. For example, having them start like an outpatient rotation during that month. One way that some like Muslim residents will sort of hack the system is they'll ask to be on night float, which will let them break their fast and then show up to work, or they'll show up to work and break their fast at work, and then they'll have the whole night to sort of drink coffee, stay up, eat, and then when they are done with their shift, it's usually at the start time of when they have to start fasting, and then they get to go home and sleep. So it's a nice way for them to be able to stay functional and working, but also fasting and keep up with their religious obligation. The thing is, fasting is for some people incredibly difficult and taxing on their body. So it is quite hard to do while you're still maintaining your regular work obligations. So just having a little bit of mercy on your Muslim trainees that, you're not eating or drinking for 14 to 16 hours, but you're still expected to give 100% effort. So just, having those conversations in advance of what's the expectation and what you can do to sort of accommodate for that. And if you can't really do much, at least allowing them to step away to break their fast as the sun is setting. Muslims have two big holidays. One is at the end of Ramadan. It's called Eid al-Fitr. And then one is about 2.5 months after that, and that's Eid al-Adha. And because, again, our calendar is on a lunar calendar, we can't really tell you what day that is in advance. And it's always really funny to be like, well, my religious holiday could be tomorrow, or it could be the day after that, but I won't be able to tell you until tonight whether or not the moon is sighted. So one way that a lot of universities are now doing is they'll actually place like a placeholder on the calendar of both of the possibilities of what the dates could be, and then allowing the person, whoever's going to be taking the vacation, to sort of tentatively take off both dates, and then whatever date that the religious holiday is set, they'll take that day off, and then the other day they'll come into work, sort of setting the expectation that they're not going to be at work for both of those days, and then whatever day the holiday ends up being, they'll take that day off, and whatever the holiday isn't, they'll come into work that day. As I mentioned with the diet and eating halal, asking if there's any way that you can accommodate for those food restrictions, offering zabiha halal options if you can, if not, offering pescatarian options, because at the very minimum, people who do keep with zabiha halal can eat fish, and if not, just having vegetarian options, and then things that are not pork, as mentioned before as well. And like I mentioned, Islam prohibits drinking alcohol. So you'll have some people who are really uncomfortable being in settings with alcohol. And this doesn't just go to trainees. I know sometimes people do like happy hours, or they do a lot of networking in places that are at bars or surrounded in places or in places that are surrounded by alcohol. A lot of observant Muslims will feel uncomfortable in places like that, or in social settings that are surrounded by alcohol. So if you can, try to do social gatherings in places that the focus isn't on drinking. I know when I gave this presentation at my residency program, people didn't realize that we have such a strong emphasis on a lot of our networking being around alcohol. And I don't know if this is really just a medicine thing, but we do so much of our networking around alcohol. Somebody brought up a good point. Like, it's not even just a religious thing at this point. There are some people who are trying to adopt a more sober lifestyle. There are some people who just don't drink because the health issues around it, or who don't drink because they are trying to keep sober, or they're pregnant, or for whatever reason. And so what we started to do is sometimes we'll do some of our networking events like at a rooftop of like there's a hotel that we have, and instead of offering alcohol, we'll do like warm drinks of like coffee and hot chocolate and things of that sort. Or we'll also do some of our social gatherings at a park, and we'll do it like barbecue style or potluck style. So there's different ways that you can offer some of these gatherings without making it uncomfortable and without making it so overly obvious that you're trying too hard. And then one final note before we open it up to the Q&A is people practice religion on a very wide spectrum. So you might have Muslims who are very, very, very observant and on the complete end of the spectrum, where a lot of these things they would consider moderate and in the middle, and they're on one end. And then you might have Muslims who are on the other end of the spectrum who are not observant at all, and they might pick and choose. And then, you'll have an overwhelming majority of people in the middle. Some pick and choose. That is the beauty of religion. Everybody practices the way that they want to practice in their own silo, individually or within their family unit or within their own community. And because of that, the religion itself is incredibly forgiving. It's incredibly individualistic, but also in the same vein, it's very community oriented. If there are not alternative resources available in like life or death situations, the rules and considerations of the religion, like I mentioned, are not applicable. So everything is sort of off the table. We always use the analogy, like if you're in a desert and there's no food or anything available to you, except, I don't know why you would see this, but except like a ham sandwich and a Miller Lite beer, and those are the only two things available for you in this desert, you can go ahead and eat that. But other than that, like, it's a very, very forgiving religion, and people practice as they wish. So things for you to keep in mind. And I hope you all took something away from this and learned, so you can be better advocates for your Muslim coworkers or people that you'll come in route with during your lifetime. So one of the questions was any challenges that I got during my professional career, and how I overcame it. I would say one of the biggest challenges is people assuming that I'm not from here, or I'm not native. I'm not like, from America, or I'm not, American born and raised. I'm like as Chicagoan as it can be. I was born and raised in Chicago. If you hear me talk about Chicago, it's like very evident that I'm from Chicago. But oftentimes people assume that because I wear hijab and because the way I talk about my religion and my culture, that I'm not from here. And the way that they'll address it is they'll, like, start yelling the questions at me, or they'll start talking louder as if speaking louder is going to make me understand. It's very difficult in those situations to navigate and tell them, like, no, I'm from here, or like I'm just as American as the next person. But sometimes people do this more so out of just lack of knowledge and not out of malintent. And I think that that's another big thing, is people they're not familiar with this. They haven't met many Muslims in their lifetime, or especially in some of the more suburban or rural parts of America, where I'm the first Muslim person that they've encountered that's not on the media. And so they have their own preconceived notion about what a Muslim is. And they'll come in and they'll, assume the worst. And so meeting me is sort of having to break that barrier and bring them in and let them know that, like, I'm just as American as the next person. And we're not these like grisly people that unfortunately the media has portrayed us out to be. There's a couple of questions. So somebody asked, they don't have anybody in their team currently who's practicing Islam, at least that they're aware of. How would it be? So they want to set up some sort of safe space or area that's designated for prayer. One thing that I know we do, we did it in our hospital or even in our clinic, is we didn't make it like a strictly Islamic prayer room. We called it, what did we call it? A meditation room, or like a thinking room, something along that sort. So it was open to everybody to be able to use, but there was a heavy focus on it being for Muslims. And we made it that way so that people could come in, and it wasn't just for like our prayer use. There was some of our Jewish community members that would go in to pray, some people who just needed like a minute to decompress after a very stressful or dark moment in the healthcare realm, would go there to decompress. And we asked for, it was like a storage unit. We asked them to sort of like clean it out, tear it down, put in some carpet, and put in a different lighting. And they did that for us. You could use something along that same line. I think when you market it as strictly Muslim, especially if you don't currently have any Muslims on your team, it's going to be a hard sell. But if you market it as something like, this is something that everybody could use regardless of faith, for like a spiritual room, or someplace to come and decompress, it might have better utility, and you might actually have people that use it more often. Somebody else asked, what is one thing I wish healthcare administration did to make it easier for Muslims in the work environment? I don't know how frequently they do this, but what I wish my hospital did when I started both med school and residency was on intake forms, ask if there was anything that I needed to be accommodated for. It was incredibly difficult when I started medical school and when I started residency to get the hijab stuff figured out, despite this being something that I had been working on for 5 years. And despite that I was the person who wrote like national policy about it, it was very difficult to get my hospital system to make the change, because as easy as it is to do something in a small department, a lot of the times for it to be a systematic change, it needs to be system-wide and hospital-wide. And what I keep reminding my program to do is, like, if you have an intake form where all you do is you ask, like, do you need a long sleeve scrub jacket? Do you need hijab in the operating room? Like, do you need something that needs to be regularly laundered? And you have that in advance when they come in and they're onboarding. It makes that really difficult and uncomfortable conversation so much easier, or even avoidable, because you'll have people who don't even want to bring it up. I know I'm not giving the talk today, but tomorrow I'm giving a presentation about some of my work, where we found that about 20% of medical students, Muslim medical students who were interested in surgery after they finish their rotation, will say that they completely changed their mind strictly because of the accommodations were difficult to get with hijab, or because they felt uncomfortable asking for accommodations. So if our hospitals are not even able to make an equitable educational experience because a woman is wearing hijab and complying with her religious obligation, and it's making her change her desire for a professional field, we're doing a huge injustice, and that's something that should be changed on a broader systematic level. Somebody asked, how do you advocate for yourself, as a Muslim, or just asking for anything? Honestly, I think we've come to a time where you have to very much be unapologetically Muslim and be yourself. If you need to ask for some time to pray, it's going to be uncomfortable at first. I'll use myself as an example. We have a pager and a phone that I carry, for example, when I'm on call. And when I need to go pray, I literally will place it down to whomever the next resident is next to me, and I'll be like, I'm going to go pray for X number of minutes, for 10 minutes. Are you okay holding the pager for this time? And there has never been a person, I mean, jokingly, they'll be like, no, I'm not. But there has never been a person who's given me any resistance. And if it's an urgent page that comes in, they'll take care of it. But if it's something that can wait 10 minutes, I will come back. When I come back, I'll take care of it. You just have to put yourself out there and ask for it, ask to go pray. Even if it's, nobody gets up to ask permission to go get a snack or to go to the bathroom or whatever the case is. You shouldn't feel like you have to ask permission to get up and go pray. I know sometimes the difficulty is in finding a place to pray. So if your office is sort of exposed, you might want to find a more comfortable place to pray, but really just having a conversation first with whoever your most senior person is, that this is something that you're going to be doing on a regular basis. And then very much just being bold enough to sort of set the boundaries that this is what I'm going to do. This is something that's important to me. This is my faith. I'm not going to falter on it. And I need these accommodations on a regular basis. Yeah. Yeah. Oh, yeah. That Kristen brought up a good point. You can tap into the office for, what is it? Yeah. Belonging and equity. So, let me see. Somebody else asked, so somebody mentioned that they were able to help a resident who observed the Shabbat and was off duty most, but not all, Friday and Saturday shifts. So for those who are unfamiliar, and whomever can correct me if I'm wrong, it's in Judaism where they cannot work from Friday sunset to Saturday sunset. And I think that involves it's a day of rest. So it's all working with all sorts of things, not just like physical work here in the workplace. The question is, where we were not able to accommodate, he worked those shifts due to the nature of healthcare. Is that a similar sentiment in Islam? Yeah. So for example, if you're not able to pray, again, I'll use myself as an example. If I'm in a surgery that's 8 hours long and I can't step away because it's incredibly difficult and I'm the only other person, it's me and the surgeon, I will make up those prayers later when I can step out. But that's not something that's, and I'm sure with observing Shabbat, that's not something that's encouraged. It's what is encouraged is to follow as best as possible and to accommodate, those missed prayers as needed, or to do things of that sort as needed. Somebody asked, how do I work with resistance regarding accommodations you need as a Muslim woman? I always try to find an advocate of somebody who's not Muslim, because this is a little unfortunate in today's day and age. Sometimes, and I'll call a spade, sometimes if a white man or a white woman is my advocate, they are able to get work done for me much easier than I can get it done for myself. So for example, in my medical school, the person who was advocating for me was the head of infectious disease, and he was this incredible white male that was just pushing through and ramming through all of the barriers that I had. And he was able to get things done so much more because he was a person of authority. He'd been at the medical school for decades and was very well respected. And I sort of went to him with my plea of what accommodations I needed and what resistance I was facing, and he was able to get it done. So if you can find somebody who can advocate for you and build that relationship with them and have them sort of power through for you, usually that helps a lot. It's very hard to do the work on your own and to trailblaze on your own, because after a while you're going to get burnt out, and oftentimes there's only so much work that you can get done as an individual. You do need a team and a village to help you get those things done. And then again, like Kristen was saying, going to either your office of belonging and equity or diversity, equity, and inclusion, whatever the office is called, but reaching out to those people because they have the resources in place, or they can point you to the people in place who can definitely get you towards that direction to help. Somebody asked how I create a dialogue amongst my coworkers in today's environment, given the current political crisis. It's difficult. It's difficult, especially because you want to stay as non-political as possible. The one piece of advice that my job gave me, and then my mom also gave me, is politics stay out of work. I mean, they said politics and religion stay out of work, but it's hard to keep religion out of work when I'm so visibly Muslim. But politics stay out of work when you want to talk about things, for example, that are like very near and dear to your heart, whether it's like political turmoil that's going on in your home country, or you know, a crisis going on, or whatever the case is, to talk about it as factually as possible, but also to try and do it in a manner where you are being as receptive to other people and their thoughts and their backgrounds as possible. Because oftentimes we get pigeonholed into our thinking and our echo chamber of what we believe. And I see this especially with any sort of like Muslim crisis, like the Syrian refugee crisis, the Rohingya refugee crisis, the Uyghur Muslims, the Afghani refugee crisis, what's going on right now in the Middle East. Oftentimes, like, it just, everything always gets assumed to be, you know, others versus Muslim. And so I think there has to be a huge differentiation about breaking apart that Muslim, it's not like an issue of religiosity or an issue against Islam, it's an issue against whatever the political situation is. But it's really difficult to have those conversations, and I try very hard to not have them at work, because I feel like it's not always the best place to have them. If you have a good enough relationship with your coworkers, I do it out of work, and I try to give them, like, you know, resources and keep it as a two-way conversation.
You can navigate your emotions in the workspace when it is so heavy.
I am not a good person navigating my emotions. Kristen asked, how do I navigate my emotions in the workplace with things that are heavy? I wear my heart on my sleeve. So if I am sad about something, you will catch me crying. And if I'm upset, I will visibly show it. So unfortunately, it's very hard for me to navigate my emotions with this, but I don't think there's anything wrong with showing human emotion. I will say, whenever, and this goes with anything, whenever things get heated to the point where you cannot control your emotions, to the point where, like, you start, you know, your voice gets loud, or you're crying so much that you can't say a full sentence, that's when you know you've towed the line, or you've crossed the line, and like the conversation needs to end for you to, you know, take a deep breath and step away. There's certain things, and this doesn't even just go with like the current crisis going on, but even when people talk to me about things like 9/11, like when patients talk to me about 9/11, and they start asking me questions about, like, when I worked at the VA, when people would ask me if I was related to the people who did 9/11, right? Like, sometimes you'll hear the most ridiculous stuff and you don't want to react, but you have to control your emotions in a way so that you still have validity in what you're saying. Because if you're just arguing or you're yelling back and forth, people don't take you seriously. I think those are all the questions that came in through the Q&A. Oh, actually. If you guys have any other questions, feel free to put it in the chat. But it was a pleasure.
It was our pleasure to have you too.
Thanks. Somebody asked what inspired you to continue this work or to start it. Actually, funny story. It was when I was a first year medical student and the scrub nurse yelled at me and made me cry in the OR because I wore my hijab at my medical school. I wore my hijab the first day. It was actually the first time I ever stepped foot in an OR. And I don't have anybody in medicine. Well, my brother was a medical student at the time, but he didn't know much. But I don't have any family members in medicine, so nobody had forewarned me of what to expect. And I didn't really know that I was going to have some sort of difficulty wearing hijab, but I had walked in and I didn't have anything covering my hijab. Um, and the scrub nurse just like, oh my God, she reamed into me and made me cry in the OR. She's like, how dare you come in here and contaminate the room and blah blah blah. She's like, your hijab or your head covering is making the whole room dirty. And I cried, and like nobody advocated for me in the moment. And as a first year medical school student, that's really disheartening. And I was like, I cannot imagine how anybody else would feel in this moment. So at the minimum, if I can help like one other person, one other Muslim woman get out of this situation so she doesn't feel humiliated in a room filled with other people, that is my goal. And I have been very fortunate to have landed in great opportunities where people have pushed and advocated for me to get me through. So it's been a huge blessing to be able to do this work and to get national change pushed through, to be able to get things like the Association of Perioperative Nursing policy change to allow women to wear hijab in the operating room. So we've come a long way over the last 5 years. I guess it's been more than 5 years. I don't get yelled at anymore when I wear my hijab. So we've accomplished something. But yeah, it is. Somebody said it's difficult to justify your existence. It is, and it's very disheartening. And it was very disheartening to do it as a medical student, and still is sometimes very disheartening to do it in 2023. So
I'll show the screen, but I would say thank you to Brown and Lifespan for partnering.
Yeah.
It was a pleasure to have you.
Yes, thank you. Thanks. Kristen said thanks to Brown and Lifespan for partnering, so I was able to do this. Thank you all for coming and attending. It's very, very nice to be able to do this and to be able to present all of this information to you all. So thank you all for joining. It's very nice to hear some of the kind words you're all saying too. So thank you all.